about us. Think about
Hello. What's going on? I see you. Eldon Blue Gregory. What's up? Over there on Instagram. I see Keto Bandito. So good to see you, brother, over there in North Carolina. Roel, One Step Forward. Hello. Andrea, what's up? Marshall, hello. Thank you, guys. Melanie, thank you. Thank you, guys, for hanging out. We're going to be taking questions all evening. D. Lynn, hello. Let's see here. Thank you, guys. Making sure we are all live everywhere. Brother Tom, what's going on, man? I know I did. I saw that. Love it. I love it. You can't flex bone. April, what's going on? I miss you. I miss you. How are you doing? Comment below. Tell me how you're doing. I love you. It's so good to see you. All right, we're taking questions. Lisa, thank you for sharing. Edna, what's up? Edna, let us know how your knee is doing. Let's see here. Where else are we at? And we're going to let a few more people come in. Terry in South Carolina, what's up? Great to see you. Let's see real quick. Yes. April, I love you. Thank you for being here tonight. All right. Real quick, Instagram and everywhere else. Did you guys, we put this up. This was a different one, but super fun with Judge George Evans talking about disability and how to file for it, what it entails. Super interesting conversation. In fact, it's like one of the more interesting conversations we've ever had on the Common Sense MD. So huge shout out to Judge Evans for doing this with us. And I thought Doc did a great job with the questions, just talking about, disability insurance and what it is and how to go about it. And it seems that representation is a big deal. Knowing what kind of how the system works is a big deal. So thank you, Judge Evans, for doing that with us. And then we had a brand new Explain This. No, it was not Explain This. This is Dive Into Diet, with nutrition coach Lucas Schmidt, talking about European wheat versus American wheat and what the difference is. For all you travelers out there, you probably have noticed you feel a little bit better when you eat bread over in Europe versus the U.S. Lucas does a great job of explaining why. So huge shout out to Common Sense MD and the Dive Into Diet episodes. Thank you, guys. I see Mama Bear's in the building. How are we looking? All right, we're going to let a few more people come in. Rose, hello. Great to see you. If you guys have questions, go ahead and put them in the comments. And I'm going to put this up as well because we put this in the weekly. Performance Weekly goes out every Tuesday at 3. Curation of the new videos plus older videos that we think are very pertinent to the current. And this is one we put up. This is Explain This episode with the star of the show, Robin Riddle, on osteoporosis. We filmed this about maybe a year or two ago. Everything in here is just super applicable and very much in terms of what we've been talking about recently with bone loss and the importance of building muscle. Robin does a great job of explaining kind of what osteoporosis is, how to treat it, how we look at it, and how to prevent it. Cool. All right. We're going to keep moving here. Doc is on his way up. I see Ivy and JC with Ivy. What's going on, Ivy? Great to see you. Robin, thank you. Thank you so much for watching that episode. Great question, Edna. And I see Doc is coming up. Okay, cool. Sam, what's going on? I see you on Instagram. There we go.
Hey, man.
What's going on, man?
How are you?
How are you?
Doing good. Doing great.
All right, so I'm going to go ahead. As you know, when Doc comes in, we start the podcast. This is the podcast
Get
episode.
rolling.
We
don't waste time.
We don't waste time. Stephen, hello.
Cut out the chit chat. You're good at chit chat.
I'm a chit chatter on here.
I'm
a chit chatter on here. I'm chit chatting with Edna here. I'm chit chatting with let's see, Lisa, Katie's in here. I'm chit-chatting. Evangeline's in here. What's going on? And that's so funny. Evangeline's talking about my mustache and my camo here.
Yeah, you got some good camera.
Thank you, Evangeline.
I think
Great.
That's my hat.
This is your hat.
Yeah.
But it goes better with my outfit.
I was going to wear it, but I couldn't find it. Now you have it.
I was trying to match my outfit.
You seen my shirt I have on?
I did. I love that
You know
shirt.
who that is?
It's Prefontaine.
Yeah.
Steve.
Mhm.
I love it.
I call him Pre.
All right, guys, y'all know the drill. If you have questions for Doc, go ahead and put it in the comments. We're going to get to everyone. Real quick, I'm going to put up, because we've got a few people in here. We got a few people on Instagram as well. I'm going to put this up. I'll be mentioning this. I talked to Katie prior to the show. We are going to be able to do a discount today on the vitamin store, the supplement store, performancemedicine.net. The code is performance10. Performance10 will get you 10% off. All you got to do is put that in the coupon code at checkout. And if it doesn't work, shoot me an email, ben@performancemedicine.net. Performance 10 will get you 10% off all vitamins this evening. I'm going to run that to about midnight tonight, and I'll put that in there as well. Performance 10 Instagram, if you guys are interested in a 10% discount on the vitamin store. Okay, great question, Sam. We'll get to that liver detox question here in a bit. Real quick, I want to talk to, let's see if I can find this. Let's start with this one. Can I get testosterone shots if I don't use estrogen or progesterone? I stopped doing the BHRT a few months ago, but I'm feeling like the testosterone shot may help with my energy and muscles. I'm sure I'll need to update blood work, but not interested in going back on the estrogen and progesterone just yet. What do you say to this listener here?
Yeah, you sure can. We do it all the time. If there's some reason why you got off the estrogen and progesterone, I don't know why you would, unless you're having some problems with it, but those could be solved. The only time personally I wouldn't use estrogen or progesterone is if you had an estrogen progesterone receptor positive breast cancer. Again, these hormones do not cause breast cancer, but you don't want to even give a bioidentical hormone if somebody already has breast cancer that's estrogen progesterone positive. But it's of course your choice. You may have a reason for it. You might not have liked some of the side effects. You might not have gotten the right doses. But in any event, yes, you sure can. We do it all the time. I even give testosterone to women that have had estrogen progesterone positive breast cancers. I particularly enjoy the pellets in those women because there's a lot of evidence that it prevents recurrence of the breast cancer. But if you do have a problem with it, testosterone could aromatize to estradiol, so we'll keep an eye on your levels. But out of all the hormones, that's the one that makes you feel the best. So, you may not be fully menopausal at this point. So it's hard to say since I don't know your clinical situation. But you sure can. Yeah. Unless there's some reason that I can't think of, why you wouldn't want to be on any of the hormones. But testosterone is a wonderful thing.
Great question there around BHRT.
And women do need it just like men do.
Yeah.
And we actually, a lot lower dose.
We went over how, I think it was last week, the week before, men need estrogen as well. Just a lot lower doses.
Yeah.
Okay, we're going to keep moving here. I'm going to put up a kind of the topic. I'm going to read this. This came in through email, and I couldn't put it in the questions here. So I'm going to read this email. So if you guys can bear with me, I'm going to start here. On July 4th, I was lightheaded all day as well as 2 days prior. So this is around just being lightheaded. That evening, I got extremely dizzy and started vomiting. Went to ER. My sodium level was 120. I was admitted and given several IVs. I went home on the next day. 3 days later, I had the same problem and went back to ER. So this is around getting dizzy and passing out, it seems. Sodium level was 122. They gave me an IV and salt tablets, which were 3 times per day, 1,000 milligrams each. I've continued to have this problem. Doctor's explanation is I drink too much water and or diet soda. I've been drinking this amount for a year, which is less than I used to drink. Okay, so they're not drinking as many diet sodas or as much water as they had. I had cut down on the diet drinks for the past year. I've consumed less than previous years. Don't understand why all of a sudden my salt just decides to drop. And we've actually talked about this, where if you drink too much water, your sodium levels can drop. Get confused, exhausted, and moody now more than ever. Can you tell me what's happening? I also have narcolepsy with excessive daytime sleepiness. I took Ritalin for years and stopped working. Been on Adderall for approximately 12 years. Talk a lot about Adderall on the show. I've taken both extended release and plain. I take 15 milligrams 4 times a day, and also take Nuvigil daily. So taking Nuvigil and Adderall, it seems. Yet I'm sleeping all the time. I can't seem to stay awake longer than an hour and have to nap again. Take B complex, so a few of the vitamins they're taking, B complex and a B12 shot. All labs are good except sodium from 2-time, it seems. This last time my calcium was low, which I don't understand. I was told I could be in menopause, but I had a complete hysterectomy 20 years ago at the age of 34. Hit surgical menopause then. Can you please recommend something to help me function again? This is Juan. Thank you for sending this, and I hope we can be a little helpful. But it sounds like there's a lot going on here.
Yeah, it's a long question, but it's kind of a typical patient type that I would get.
Yeah.
Nobody comes to see me for anything easy anymore. People see me, they're dissatisfied with the medical system. And rightly so in a lot of cases.
They've been to all other options, it seems.
Well, that's a complex problem. But when I look at this question, July 4th, it's party day. I wonder if you were partying too much. I don't know. Probably not, but that is a common date. You could party, drink too much, get dehydrated, it's hot. But one thing that jumps out at me is I never prescribe Adderall along with Nuvigil or Provigil. That's 2 stimulants that can actually cause hyponatremia because they work on that this thing called antidiuretic hormone that you have in your brain. Again, like you said, the most common cause of hyponatremia, low sodium, would be drinking too much water and depleting your salt and not eating enough salt. Salt's been demonized in our country when really salt's a very good thing for the vast majority of people. The worst recommendation we can give people is to eat a low-fat, low-sodium diet.
Yep.
And yes, that's typically what most doctors still do. But anyway, so, if you weren't drinking too much water, and I wouldn't drink diet sodas of any kind anyway. I don't think that probably caused it. But, you may have been dehydrated, been overheated because you say you didn't change the amount that you drink or the sodium that you intake. But then I start thinking, if it's not that, is it a drug problem, a drug reaction? A side effect to a drug. Remember, you can take a drug your whole life and do fine with it, and boom, one day you have a serious problem with it. And really, that's just overload. You're taking I'm not against either of those medicines. I use a lot of both of them. I just never use them together. But really, it's contraindicated to use them together. I know some doctors go out on a limb and do it, but that's too much stimulants, and it's probably affecting your antidiuretic hormone. There's a thing, one of the causes of hyponatremia would be something called SIADH, syndrome of inappropriate antidiuretic hormone. And it gets a little complex, too complex to spend, in the short amount of period of time we have. But depending on the volume of the fluids in your body and relative to the sodium that you have, there's 3 different really types of hyponatremia. Hypovolumic hyponatremia is probably the most common one. But in any event, it's probably those 2 medicines taken together. And what I would do, besides get a thorough, it sounds like you've already gotten the blood work, you've been to the ER twice. Even vomiting itself can cause low sodium. Hopefully, I'd like to see what other medications you take, but Certainly diuretics can cause it. But when you get that low, it causes cerebral edema. You can go into a coma and die from hyponatremia.
Yeah.
So, please stop one of those medications. It's just medication overload, in my opinion. You're getting too much stimulation. Again, in functional medicine, we try to find the root cause of the problem. And that sounds like the root cause of the problem to me. That's not an insignificant dose of Adderall you're on. You're taking 60 milligrams of Adderall. That's a lot of Adderall. And then you add Nuvigil on top of it. I don't know if you're on 200, 300 milligrams, but that's high dose stuff. And sometimes, these medicines and people that you have narcolepsy, you may have ADHD. I don't know, but I think you're overdoing it with those medications. Less is better, and do the other things, and only take these medicines when you absolutely need them, because you're messing up your electrolytes for one thing. Now, whether something contributed like dehydration or you drank too much water and you didn't eat enough salt, possibly. I'd like to look at your other medications at some point to kind of look at the other stuff. But my gut feeling is that you shouldn't be on both those medicines, especially at that kind of dose. You should get off one of them and maybe go to a more reasonable dose on the other. Nuvigil is meant to treat narcolepsy, ADD. Adderall is meant to treat ADHD. And there is some overlap, but I think you're probably overdoing it with both those. Remember, less is better. And do the other things like exercise. Make sure you're getting enough sleep, because even though those are stimulants, they can cause sedation in people with ADHD. If you drink a cup of coffee, what happens is it puts you to sleep. You have ADHD. So, you just need to tamper down these. And I know you've had this problem for a long time, but and you may have tolerated those medicines, at this point for a pretty good time. But like I tell a lot of patients when they're sitting in my office telling me, this has never happened to me before. I go, well, you've never been this old either. Your metabolism changes. And, I don't know how old you are, but as you get older, you don't tolerate these medicines as well as you might do as a young person. So, so it's interesting. I mean, I don't know if July 4th you had some alcohol that may have interfered with some of the stuff, overheated, dehydrated. Who knows? But my advice to you is wean down, get off both those. Just take one if you need it, but don't take both at the same time.
That is super.
It probably cause your low sodium. I bet that's what caused it.
Taking both at the same time.
I bet you did.
That's interesting.
Along with other cofactors, but
yeah. Well, thank you for sending that question over email. I hope that helps just a little bit. A couple things I heard there was, one, I did not realize you can be okay on a medication for a certain period of time, then all of a sudden, you're not. That's wild to me.
You could take penicillin all your life, and boom, one day you're allergic to it.
That's wild to me.
Yeah.
Huh. And that's why you always talk about adding things one at a time, just so you know.
Yeah.
Well, it's a great question. Great talk. Thank you for letting us kind of
that's a good case.
Yeah, I hope that helps a little bit. One, I see Katie Lynn's in the building from our Bristol office. Katie, what's going on? Great to see you. Tyler's in the building. Tyler, I got to see you a couple weeks ago. So good to see you, Tyler.
Katie, we love Samantha already.
Yes,
thank you.
That's right. That's right. Samantha is amazing. Carter's in the building. We got Robin Riddle in the building. I'm going to put this up for Robin because she might not know yet that we put this in the weekly email this week. This is the throwback on osteoporosis. We filmed this a while back. Still super, super relevant today. So thank you, Robin, for this episode. And we're going to, let's see here. I'm seeing we got a bunch of questions coming in. Thank y'all for all these questions. I see Nancy's question. I see Teresa. I see you. And we're over here. Montana's in here. Montana, what's going on? Great to see you over there on Instagram.
Hey, Montana.
Okay, we're taking questions. If you got a question for Doc, go ahead and put it in the comments.
While you're putting your questions in, I will comment on one other thing, because I saw a very interesting patient today. New patient, nightmarish history, a very nice lady. Got caught up in the medical system and just horrible consequences. I mean, if I could tell you the story, you wouldn't believe it. But it's a result really of a breakdown of our medical system and over prescribing.
Mm.
It almost killed her. I mean, it was lucky she's alive. And it all has to do with back surgeries that she should never have gotten. And then, which she developed because it was bad. I mean, it was worse than not having a back surgery by far. Then she developed almost like a PTSD situation over it. Saw a psychiatrist who prescribed a buttload of medicines for her that ended up making her suicidal and ended up becoming a mental patient. You know, this patient's as normal as you and me. Just got really screwed by the medical system. Just unbelievable things like this happen. So you really have to take care of yourself and use some common sense about some of this stuff and avoid taking too many medications, avoid getting surgeries that are not going to work and that are very risky. Anyway, that just reminded me of one of my last patients today.
And also, like you always say, weigh the risk versus the benefits. Sometimes the risks are more heavier weight than the benefits are.
Yeah.
All right, great topics, guys. As you can see there, I got Performance 10 there, just in case anybody forgets it. Performance 10, 10% off the vitamins tonight only for those that are interested. performancemedicine.net/shop. All right, we're going to get to the questions here. I see One Step Forward over on YouTube. Thank you, One Step Forward, for being patient with me. Is there any suggestions or supplements for an enlarged prostate? PSA values are good. I'm over 60. Is this just an age-related issue?
Yeah, it definitely is an age-related issue. At 70, I can commiserate with you. I have the same thing, without a doubt. But yeah, I mean, you can take. Certainly, I would start out doing the supplements like saw palmetto, stinging nettle root, pumpkin seed. There's a host of other things you can try. You know, I know Life Extension makes a prostate formula that has that in it. It's got some zinc and boron as well. You know, definitely start out with something like that. You know, saw palmetto is the one that everybody thinks about because it locks down DHT, dihydrotestosterone, which is responsible for prostate enlargement. And then, you know, if it's not working, then there's some medications you can take. My favorite go-to is a daily Cialis, tadalafil, which is a really great medicine for multiple uses. It's not just for ED. It really helps your prostate tremendously. It is a nitric oxide agonist, so it's a vasodilator. I give it even to women for Raynaud's phenomenon. So it lowers your blood pressure a little bit. It's a good all-around medicine. So if the other herbals don't work, you might consider getting on low-dose daily tadalafil. It works real well. And then, you know, there's other heavy hitters like Flomax. You know, if your prostate's huge and you have to get on finasteride, which can have a lot of side effects. You know, it's another thing. But it needs to be, you know, looked at with a doctor who knows what they're doing with prostate issues. I saw a couple prostate issues like that today. And one of them was prostate cancer, but it's much more common to have an enlarged prostate. But interesting, yeah, us old men have prostate problems. You know, it's the bane of an old man's existence at times is prostate issues, having to get up at night, that type of thing. But anyway, so try the Life Extension first.
You know, it's interesting. This weekend, I was talking with my Uncle Bob, your brother, about Granddad. Now, he had prostate issues at the end of his life. And it is like sometimes it's helpful to like take care of it. And sometimes it's not. He had prostate cancer, but
the treatment for him was worse than having.
That's what Bob was telling me. It was like the treatment was worse.
Yeah. Yeah.
Super interesting.
You know, we learn more and more.
Yeah.
Nowadays there's better treatments than he had, more information about it. But certainly it's something you need to talk over and get a couple of good opinions on. if you're considering treatment for BPH or prostate cancer.
All right, great topic there, guys. Thank you for that one step forward. I see Rachel's in here. Rachel, it's great to see you today in the Kingsport office. So good to see you. Good to see you this weekend as well. Let's get to, let's see, I'm looking. Oh, there we go, Edna. Edna's asking, can B12 levels get too high?
B12 is a water-soluble vitamin. If you are taking B12 and you get a blood level, it's going to stay high. So I've never had anybody get into a problem with too much B12. You're just going to pee it out if you get too much. So I would say no. There's always a caveat. You could overdose on anything if you took a crap load of it, and that's all you took. You know, if all you did was take a ton of B12 month after month after month, you could deplete your other B vitamins. So, but that'd be very hard to do. So if it came back high, don't worry about it.
That's one. Is that the one where you don't even check the levels? Because if you're taking B12 or like a Vitotrim, your levels are they're gonna be high.
Yeah, but it's on our Cleveland Heart Panel, so we check it. More looking for deficiencies.
All right, let's keep moving. I see Kaylin's in here. Kaylin, so good to see you. Thank you for being in here. Okay, let's get to Keto Bandito. Keto, so good to see you, brother. Do you ever prescribe an aromatase inhibitor to patients that are using DHEA?
I usually don't have to. You know, DHEA is not going to pump your T levels up that high. In men, it just won't do it hardly at all. In women, it may, but usually you want it to be a little higher. But I usually don't see a lot of problems with, you know, that popping up your DHT levels too much to where I have to do it. Just like I said before, though, you could overdo anything. And certainly, I don't like to use the high doses of DHEA like some people do. I limit it to 15 milligrams in women because they start getting side effects like hair loss. But men, I don't use, you know, I take 25, but, you know, you can take, certainly a lot of men take 50, 100. They do have a keto DHEA, since your name's Keto Bandito, and it's one that will not affect your hormone levels. It also doesn't really work that well, but I like a low dose DHEA supplement.
All right, Keto, thank you for the question there. I see Kelsey's in the building from our Bristol office. Kelsey, so good to see you. Rachel's got Robbie and Wesley watching too. Thank you guys for hanging out. Hopefully like over dinner or something cool.
Wesley's a huggable baby.
He's a huggable baby. He's adorable. How can
really
you not hug him?
He really is.
Shout out to Wesley. Okay, we're going to keep moving here, guys. I'm just looking for my questions. Let me see if I just don't want to skip people. Let's go to Amanda here, and I think I missed Roel. I'm already taking testosterone cream. Would that affect with hair loss?
It can. It can. You know, especially if it's converting into dihydrotestosterone. So you may be taking too much, especially, you know, if you're combining it with DHEA, you may be getting too much. So check your levels. And, you know, you may be one that could take, you know, even as a female, you know, a saw palmetto type herbal.
I'm going to put this up here because her first question was around hair loss. So I'm sorry, Amanda, I missed this one. So this was the first question, and the follow-up was with the testosterone cream.
Well, remember, hair loves estrogen. It's not real fond of testosterone. That's why if you ever see a bodybuilder, if you notice one thing about them, they're all bald. You know, if you get a trainer that's not bald, they're not worth it. So they all lose their hair because they overdo the steroids. You know, these huge muscle bound guys, but kind of like you're getting, you know, what's that? Tom said, bone doesn't flex. Bone don't flex. I think that's what Tom said.
Tom says you can't flex bone. I still think that's the funniest comment ever.
That's a great comment.
I love that. I love it.
That's a 10. So again, hair low estrogen. It is not fond of testosterone, so you got to be careful. But there's, again, I haven't had many women that I've treated that I couldn't change, get them growing hair. Men, when they get bald, it's it's hair replacement time. If you want to go that route, but certainly you could take a prostate formula, and with thinning hair, we do have a vitamin supplement that we use called Happy Healthy Hair, which I need to get some more of.
I know you mentioned that.
I used my last one tonight. So, but so I use that vitamin supplement, which I think is way better than Nutrafol. A lot of times I use minoxidil orally. That's the form of Rogaine. It doesn't work too well if you put it topically, I don't think. So you can take the pill, 2.5 milligrams, very safe, of minoxidil. And then sometimes I use a really low dose finasteride, 1 milligram, which shouldn't cause a lot of side effects. 5 milligram finasteride to shrink the prostate would. So I call it the triple play. So you can do that and check your levels of testosterone and DHT. Check your levels of estrogen. Certainly, that's when women get thinning hair, is when they start losing their estrogen, as well as heart attacks, dementia, osteoporosis, everything else we use estrogen for in women.
I think we had, I saw a finasteride question somewhere in here. I'll find that here in just a minute. There was another, it's not ontogeny C. There was something I was talking with Kelly about that helps with hair loss too.
I think she's talking about exosomes.
Exosomes?
Yeah.
Okay, so it's not ontogeny C that helps with.
No,
okay.
Just something new.
All right, guys. As you can see there, Performance 10 right down there. That gets you 10% off our vitamin store tonight. It's going to go till midnight tonight.
Even the hair vitamin?
Even the hair vitamin. Happy Healthy Hair. Oh. Happy Healthy Hair is 10% off tonight using that code Performance 10. It's pinned up there. I see Kelly's in here. Kelly, what's going on? Morgan, hello. Great to see you. Kelly, what was that? Was it exosomes?
It was exosomes.
The ontogeny C?
No, it's a different product.
It's a different than ontogeny C, but similar. Let's get to Roel here. Doctor, the last 3 weeks, my wife has been having a reaction with reaction like hives. We've done an elimination diet and changed detergent, but can't figure it out. Comes and goes. Any thoughts around this? Well, shoot, our thoughts are with your wife here, Roel.
Hives are tough. About 90% of the time, we never know what causes them. Sometimes there's an obvious new medication that you've taken, or extreme stress can cause hives. So can heat. I think I've seen some people this summer with hives I thought were heat related, and certainly a very humid, hot summer. But I'll be honest with you, most of the time we don't know. You can go to extreme lengths of having, allergy testing done, but usually they don't find a reason for hives. It's going to go away, usually, not always, but most time it'll go away. But I suggest, of course, using Benadryl if it's really bad, or Zyrtec. I'll also take Pepsid AC, which is a histamine blocker as well. And try to think of it. Have you changed soaps, detergents, foods, supplements, medicines, anything like that, and try to get to the bottom of it. Stress. But like I say, most of the time we never find it and it goes away. Those are some of the things you can do. I mean, sometimes it may get so severe you have to take a really short course of steroids. I don't like to do that unless I have to.
Roel, keep us posted with how she's doing. It is so wild. A lot of it is, you just don't know. It could be a multitude of things. But Roel, thank you for the question. I'm going to put this up here because we've got quite a few people with us tonight. Diane saying we really appreciate your lives every Tuesday. We appreciate you guys. Thank y'all for hanging out with us every Tuesday from 7 to 8, talking health and wellness. This means the world to us, and this comment means the world to me. So thank you, Diane, for that. Okay, let's keep moving. Let's see if I've already missed my spot here. Let's get to Nancy here, and then I'll get to I see Lori's question. Okay, Nancy's asking, any natural supplements to help with dry eye syndrome?
Yeah, I think the best one that I take would be omega-3s, fish oil, krill, or something like that. That's, to me, the best supplement you can take. And vitamin E, probably I would throw in there as well.
All right. Thank you, Nancy. Let's get to Kristen here. Best supplement for inflammation. I forgot to ask my appointment recently in Johnson City. Thank you for coming into the Johnson City office, Kristen. What's your thoughts on this?
I say the best supplements are pain formula.
Yeah.
Which we can pop up there. But
yeah.
Because it has all the good stuff and more. It's got the turmeric, which is curcumin, which is probably the #1 supplement. This thing has, let's see, it's got turmeric, it's got MSM, it's got willow bark, it's got bromelain, boswellia, paractin, which to me is the secret ingredient that we figured out. And of course, the turmeric won't work unless you put black pepper extract in it. So I take this every day because I'm 70 years old and I have, a little arthritis. I've got degeneration in my back. So overall, for inflammation, that's the best thing you can take because it's all together. You have 7 things in one pill.
Yeah.
For about probably the same price you'd pay for turmeric by itself, close to it.
Great question, Kristen. I hope that helps a little bit. Let's get to Anita. Thank you, Anita, for being patient with me. I've noticed ads for tirzepatide pill. Is that a real option now? That's a great question.
We haven't found it. It's got to be a compounded pill. Again, they're trying to come up with an oral GLP-1, GIP, or even the new triple G product, but they haven't been FDA approved. So who knows? But in general, I've found that these oral GLPs just don't work too well. I just haven't had luck with them. I've told people to go get them and all, but I just haven't had the luck with them. The shots are way, way better. I've even done some kind of internal and external testing comparing them, especially because insurance doesn't want to pay for Zepbound anymore. They'll switch you to WeGo if your insurance even would pay for that. It's a completely different medication, which is ridiculous. I think it's Blue Cross doing that right now. So these insurance companies are playing with your life, in my opinion. So you could try it. It's probably not going to hurt you, but I like tirzepatide. I take a microdose myself, not for weight loss or diabetes, but really use it for longevity as an anti-inflammatory. I really think that combination, that drug is the drug discovery of this century.
Tirzepatide?
Of the 21st century.
Yeah.
Well, the GLPs in general.
In general.
But that's my favorite one.
Yeah.
But yeah, you had insulin in 1922. You had penicillin discovered back in the 20s. This brand of medicine is a Nobel Prize winning, life-changing agent for metabolic syndrome and a lot of other things. So it's unbelievable, really. Not everybody can take it but most people can. Most people probably should, because 92% of us and Americans have insulin resistance. That's what it's for. But it has all these other great side effects like less heart attacks, less strokes, less dementia, reversal of non-alcoholic fatty liver, reversal of chronic renal disease for diabetics. It's just an amazing class of medications. And they'll be better, and there'll be different ones and better. Maybe this triple G will come out soon. But you can try it, but I don't think it's going to work that good.
Would you
it's just hard to absorb.
Would you say that something like this in a pill would be similar to berberine?
I don't know. It's going to be expensive. I'll tell you that much. Berberine's cheap. I compare berberine more to metformin. It's probably metformin equal without the side effects of metformin.
Okay.
So.
All right, let's keep moving here, guys. Thank y'all so much for the questions. Let's get to Evangeline here. Thank you, Evangeline, for being with us. Thoughts on proper doses for astaxanthin?
Yeah.
Is that right?
I think you pronounced that right.
Astaxanthin. I'm currently taking 12 milligrams per day. However, I'm not certain it's an adequate dosage. And is there any contraindications when taking, and he put it down
Tribulus? No, I don't think so.
Fenugreek and DHEA?
No, I don't see any contraindication. 12 milligrams is a good dose of it.
Okay.
It's great for eye health, as well as it's a good combination to potentiate some of those other things you're taking. So That's a fine dose.
All right. Thank you, Evangeline. Let's keep moving. Let's get Linda up here. What's on Doc's shirt? That's
Hey, Linda.
Prefontaine.
Steve Prefontaine. I wore this because Prefontaine, who was one of our greatest 10K or 5 and 10K runners, Olympian, life cut short by a car accident at age 24 or 27. He was an Olympian. He was a kind of like a cult hero. He was in a car with Frank Shorter. Frank Shorter had just let him out. He got in his sports car and crashed and died prematurely. He's really a co-founder of Nike along with
he really
Phil
is.
Knight.
Yeah.
But yeah, he's kind of a sports hero. And I did get this shirt, and because it reminds me of Ben's mustache. You know.
Let's. Speaking of which, I thought I saw something from Mark. Is Ben's sudden decision to grow out his hair a quiet cry for help or an attempt to join the Doug dynasty?
That may be a classic right there. That may be as good as Bone Don't Flex or whatever.
This is true. My hair is getting longer. I got the mustache now. It's a good observation.
I know. You know. I don't know, Mark.
D-Lynn thinks I need to put a curve in my bill. You know, I'm going flat bill right now. I need to.
Yeah, you can go one of two ways. I prefer the curve.
Yeah.
Ben prefers the flat. That's more like a baseball look.
I probably do need this. Does look a little. You know, I need to make it a little more curved there. Thank you, D-Lynn. I love you.
I think Ben is going to try out for a movie role. I really do.
Let's get to Tom's question. Brother Tom is saying, I've been sweating pretty bad at night and got in touch with Amber. She thinks it's stress related and wants me to take some stress relief vitamins to help. But is there anything else I can be doing? Well, Tom, we're thinking about you. What's your thoughts on this?
Yeah, I mean, of course, look at your hormones. I'm sure Amber's looking at hormone levels on you because certainly, men can have night sweats just like women do from either too high or too low hormones and the ratios. But some people they sleep hot. Some people sleep cold. That's why I love my Sleep 8 mattress cover. It's an amazing thing that's probably gets me about an hour or more of sleep. And I'm a terrible sleeper because it cools my body down. It uses AI to figure it out. So it makes a ton of temperature adjustments in the middle of the night. So when you get in the bed, it's kind of toasty. And then as you fall asleep, it goes and it measures all your sleep levels too.
Yeah.
Better than my Oura Ring.
Yeah.
So it chills your body at night. You can get a chilling pad too. This thing works using AI. It's just amazing. In the morning, it kind of slowly warms you up a little bit. So a Sleep 8 bed is fantastic. You're probably like me, you may be exercising too close to bedtime. Be interesting to see what your sleep parameters look like. If you have sleep apnea or anything like that.
Have you ever say you did like a really hard workout in the heat because it's hot now, then get in the shower, then get out of the shower and you just cannot stop sweating?
Yeah.
That I do that all the time.
That's why I always in my shower with cold water.
Yeah.
I like a warm, hot shower, but I always when I used to, I turn it down.
Yeah.
And end up with it being cold.
But I think the stress relief could be a big help as well. Sometimes
if it is
that can be
related,
stress induced. If
no doubt it can.
Yeah.
I mean, gosh, you've been a doctor as long as I have and been in business. Sometimes you start worrying.
Yeah.
And I think worry makes you sweat.
Yeah. Yeah.
I really do. Plus, it's better to sleep cold. Turn your thermometer down. Get a chill blanket at least.
Tom, thank you, brother. Thank you for being here as always. Lori's asking, I recently was diagnosed with upper respiratory infection, and 2 weeks later, I'm still coughing. Sore in the neck area, hurts when coughing, and hoarseness comes and goes. What do you recommend? Well, Lori, we hope you feel better. I know this sort of thing has been going around. What's your thoughts on this?
Yeah, hopefully you get checked out. You need to be seen by a professional to see what it was. I mean, did you have COVID? Did you have flu? Do you have strep? Which you can get with one test over the counter. Again, I'm not big on the COVID testing because I don't trust the test so much, but you need to probably rule out the other stuff as well. But that cough is going to last you 4 weeks. We call it a month-long cough. I don't know if you took anything for it. You know, if your neck is sore, you probably have some lymphedema, but certainly something needs to be looked at. You could have negative for all. Okay, you could have walking pneumonia, which is mycoplasma, for which you need a Z-Pack. So if you're still coughing your head off and have done nothing for it, I'd take a Z-Pack personally, because it may be one of those atypicals. And if you follow my blogs at all, I really think Zithromax works for viruses.
That is kind of a hot take of yours.
Yeah, it doesn't make any sense at all, but I've just seen it.
Yeah.
Also saw it on my dog cure a wart that was definitely caused by a virus. The vet prescribed an antiviral. I go to get it, and it's a Z-Pack. I said, this won't work. That's a wart caused by a virus. And so I gave Izzy the Z-Pack. The wart was gone in 5 days. I couldn't believe it. But anyway, so you might and get a chest x-ray if you're not getting better, just to make sure. But that cough is going to persist. I'm telling you. You might even, we need to be checked out for sure. There's a lot of different things I'll use for that. Tessalon pearls, sometimes a expectorant. Yes, Z-Pack. Does that mean you took one?
Did you take one, Lori?
Hopefully you took one.
Unless I'm going to keep moving here to get to as many as I can. We appreciate you guys being patient with us this evening. If I can find where I was, I know I saw. Hold on. There we go. Let's go to Dana here. Thank you, Dana. Is MNM safe to take daily versus NAD plus injections? If so, how much and how often?
Yeah, it's safe to take. That or NR, they're about equal. I've been disappointed with the NAD plus injections.
Really?
Yeah.
That's interesting.
I've seen them help too much. Now I'm getting a cough. I think I'm allergic to this mic. But definitely, I would not recommend NAD infusions. You're going to pay out the wazoo at some of these clinics for an NAD infusion, and you have to, if you do it safely, because it can be dangerous. Take 4 hours at least. And then you'll flush up. And listen to Dr. Atia's take and interviewing the guy that's the head of the Buck Institute on NAD infusions are both radically against them. I just haven't found the injections to, we've tried them on a few people. I just haven't found them to be that energizing. So NMN versus NR, you can take a combination of both. They work a little bit differently, but both, precursors to producing NAD plus, probably glutathione. But so NMN, I'd have to look the dose up because it's not sitting right here. And I couldn't tell you off the top of my head what the dose is for NR or NMN, save my life. But, it's a daily thing.
Did we do a podcast on maybe not NMN, but NR, rapamycin, maybe, in the rapamycin episode?
I don't think we've done a podcast, but Atia talks about it all the time. If you want to take a deep dive, just Google NMM or NR with Peter Atia and really get a deep dive on that. He doesn't think either one of them or resveratrol is that beneficial, to be honest with you, for longevity. He does rapamycin like I do, but I know it's the fad and all, but the injectable form is it's not worth the money you're going to pay for it.
And Dana, if you'll shoot me an email just to remind me, we'll get the NMN doses once we're in front of it. So shoot me an email to remind me, and I'll email you back with some doses. Let's get to this from Mark here. Could many new post-COVID diabetes cases could be non-autoimmune in nature, meaning they lack auto antibodies, virus-triggered B-cell dysfunction? If the diabetes is truly non-autoimmune, aggressive insulin therapy may be unnecessary, in some cases reversible. What's your thoughts?
I don't know. I mean, jury's out on that. I've certainly seen 6 cases of vaccine-induced type 1 diabetics and people in their mid-50s who don't come down with type 1 diabetes. So, it's definitely can be a possibility with the vaccine. And again, COVID could also trigger it off. But I'd rather take my chances with the COVID than that vaccine. How about you?
Same.
I saw on the news tonight where RFK, is not recommending the COVID vaccines for children or pregnant women. Thank God. But the head of the American Pediatric Society is condemning that. They want to give all 6-month-old babies a COVID shot.
That's wild to me.
I can't understand it.
Yeah.
I really can't. But anyway.
Mark, thank you for the question, brother. Let's keep moving here. I want to get to Max. Thank you, Max, for being here. My creatinine is 0.58, which is low. What do I need to do to get it to a normal level fast? We've been talking about creatinine with creatine and building muscle.
Well, creatinine is totally different than creatine. The creatinine, you got a low creatinine, means your kidneys are functioning great. You don't want it higher. The only ones you worry about is a high one. So, you're probably hydrating well and all. So the important number is a GFR, glomerular filtration rate. So, don't worry about it. If it's high, sometimes I'll get a cystatin C and look at it. But if it's point, I wouldn't worry about it. If you're healthy, you're healthy. Sound like you're healthy. Don't try to get it to a high level.
Let's see here, Max. I hope that helps. It seems like great news. I'm going to keep moving here. Let's go to Danny here. Thank you, Danny. When taking methylene blue, do you take it straight or take a day or so off every now and then?
I take a day or so off, which I do with most of my vitamins, most all of them. 1 or 2 days a week, I won't take them, usually 1 day a week. But methylene blue I love methylene blue, and I like it combined with my red light therapy. I think it really doubles down on your energy levels. I love it.
Took mine today. Thank you, Danny, for that question. Connie's asking, best time of day to take the Dr. Rogers full magnesium?
At night, about an hour before you go to bed.
All right. Thank you, Connie Lynn. Let's keep moving here. Seems that Lori is, she did take a Z-Pack.
Good. So, I have found some, there's some resistance developing to a Z-Pack. So if you still have a productive cough, fevers, it's in your chest, then you might have to go on a little heavier hitter, like maybe a round of Augmentin or Doxy. But certainly, especially if you're developing pleuritic type symptoms. So don't let this thing linger. Get it treated. Maybe get an X-ray.
Let's keep moving.
CBC
here.
blood count. Let's see what your white count is.
Shelby, I see you. Thank you, Shelby, for being in here tonight. Let's see if I know I'm missing questions, and I apologize. Just get to Lori's question around what are the side effects of finasteride?
Sexual dysfunction. That's the main side effect of it is sexual dysfunction. Decreased libido, certainly in men, erectile dysfunction and that type of thing. And again, in low doses for hair, I just don't see it causing problems.
All right. Thank you, Lori, for that. And I'm looking for the questions I might have missed. Let's get to Lisa here. Thank you, Lisa. It's been right at 2 months now since my hamstring rupture. I don't seem to be getting any better with it at all. It hurts pretty bad, and I'm having muscle spasm pretty bad. I'm taking a muscle relaxer. When it wears off, spasms again. I don't know what else to do with this. Please help me. Happy birthday to me Thursday. Well, happy birthday to you, Lisa. Going to be in 2 days here. I hope you have a wonderful birthday. I hope this doesn't bother you as bad on Thursday. Any words of wisdom?
I had a patient today that had a hamstring tear and spasms. They at first thought it was her abductor, but it wasn't. MRIs, everything. What I would do is I'd really try to find a physical therapist that does pelvic floor exercises. They're specialists and they could probably help you. I don't think the muscle relaxer is going to help you much. And again, with this type of injury or surgery, especially with surgery, it takes a long time to get better. maybe red light therapy may help you. I use a peptide that I think aids in healing called BPC 157 orally. You can inject it as well daily for 30 days, but it gets expensive, and you'd probably be about as better off. Maybe not. The shot's probably better, but you could at least maybe get a hold of some oral BPC 157, which I think we have that on our site. I think we do.
Oral BPC.
I think we do
on our website.
Yeah,
I don't think so. We have it in office.
Oh, we don't have it. Okay,
we definitely have it in
our offices. Yeah, you're probably right. That's one peptide I really like for healing. Well, that's a toughie. It's going to take a while.
Lisa, happy early birthday. Thank you for being in here as always, and keep us posted with how this entry is going. I hope that helps just a little bit. I want to put this up from Don and Steve. What is the micro or maintenance dose of semaglutide?
It just depends on where you're at. My recommendation is if you're taking it for weight loss, then, of course, you start out at 0.25 milligrams for 4 weeks, go to 0.5 for 4 weeks, go to 1 for 4 weeks, you can go to 1.4, you can go up to 2, 2.4. But a microdose would be something like, instead of 0.25, 0.1. Even 0.075 lasts you forever. So see where if your weight's good, you feel good, you can work it down, but just stay on it, because remember, that is a maintenance medication. That's what a lot of people don't understand about the GLPs. They're like blood pressure medicines. They're meant to be stayed on. You're not going to lose 30 pounds and stop your semaglutide or tirzepatide and then maintain it. Of course, you need to change. Most people need to change their dietary habits, but it's a maintenance medicine. Just work your dose to the lowest one you maintain your weight on, and you feel the best on.
Thank you, Don and Steve. I hope did we get that? I see you. The micro maintenance of the Ozempic. Let me know if that helps, Don and Steve. I'm going to get to Max real quick, and we're going to call it an evening. I'm on my 3rd or 4th month of taking spike protein detox capsules. How long do I need to take it to clear completely, or do you think I've had enough and need to stop?
I think you've had enough. I think go ahead and stop. GFR is 118. Good Lord, that's fantastic. That means you've got great renal function.
Okay.
But yeah, great. I think I usually do it for 3 months on people. So
thank you, Max. I see Ivy's in here. I started BPC 157 today locally for plantar fasciitis healing. That's awesome.
I don't know anybody that knows how to mix it like Ivy does.
The best. The absolute
when you mix
best.
that stuff, you really got to know what you do. Fantastic, Ivy. I love to hear that.
Thank you, Ivy. Okay, thank you, Don and Steve. All right, guys. Lisa, you're getting a lot of happy birthdays over on YouTube, guys. Shout out to Lisa. Happy early birthday to you. I'm going to put this up from Barbara. You're on the news. That's cool. I've gotten this a few times. I've gotten a few like, hey, I saw Dr. Rogers on the news.
I hope it was a good news.
I do too. All right, guys.
Probably the Blue Emu commercial.
I think it
it's being played like nationally.
I bet that's what
a few people say, I was in New York City and saw you on TV. But that's not because I'm anything special, believe me.
I love it. I think that's still cool. That's super cool. Barbara, thank you for that. Thank you so much, Montana. So good to see you. Have a great rest of the week. 10 out of 10. Guys, tell us how we did. How we do. Let us know in the comments. He's got to go. He's going to play some pickleball with your brother.
I'm playing pickleball tonight.
I see a 10 from Danny. Thank you. D. Lynn, a 10. Thank you. Real quick, as you see right there, that ticker, Performance 10% off tonight only on the store. It'll be up. It'll leave at midnight. Leave at midnight. You have until midnight. 10% off all the vitamins on performancemedicine.net/shop. And I believe we're out. That was fun, man.
You did good.
Thank you. I'm going to turn this off. Okay, now we're good there. All right, guys. Instagram, thank you guys so much. Thank you. Thank you, Rose. Thank you, Lisa. Lisa giving us a 10. That's amazing. Thank you, Rose.
Hey, Terry.
Look at all this. Man, this is amazing. Y'all are the best. Y'all are the best. Go ahead. I'll sign us off. Guys, Dave, thank you. Thank you so much. We love doing this. Thank you guys for being here. Y'all make this show amazing. We do this every Tuesday, 7 to 8. Guys, to get 10% off, Performance 10 is the only place that No one else knows it. Performance 10% off for you guys. Take advantage of it. Thank you, Mark. I love you, brother. All right, we're out. See you, Instagram. Let's see if I can find my outro. You getting ready to play some pickleball?
I am, yeah.
Don't go away.